sinuses lah regarding this. Okay, so for today's lecture, it's on the anatomy of the nose, nasopharynx, and paranasal sinuses. Can everyone see my desktop? The slides that I'm sharing?
Yes.
Okay. Okay, so it's quite simple. It's just the nose and nasopharynx and paranasal sinuses. Okay, so you need to learn, you need to know how to describe the nose, the nasal cavity, lateral nasal walls. So you have lateral nasal wall and also your septum in the middle. Okay, and you need to know some clinical correlations related to the nasal cavity anatomy. You also need to know the paranasal sinuses. So you have 4 paranasal sinuses that you need to know, and also the nasopharynx. Okay, so this is your respiratory tract. It is divided into upper and lower respiratory tracts. Okay, so in your upper respiratory tract, we have the nasal cavity, pharynx, and larynx. So in this lecture, we will cover nasal cavity and one part of the pharynx. How many parts of the pharynx do we have?
3.
3, good. Okay, so we will only cover the nasopharynx, the first part of the pharynx in this lecture. Okay, so first we will talk a bit about the external nose. It's not very important for you to know, but just briefly lah. Okay, what consists of the external nose? So you have the root of the nose here. This is the dorsum, and this is the apex of the nose. Okay, and you have the nares, which is the hole. Okay, and then you have your nasal septum in the middle, dividing your right and left nasal cavities, and this is the ala lah. Okay, on the side. So just to show you, if we dissect, we remove the skin and fat layers on your nose, you will find that the most part of your nose is made of cartilage and not bone. The nasal bone is actually just quite small here. In the upper side of your nose lah. Okay, just a small part of the nasal bone. Most part of your nose is made of cartilage. Okay, so you have here the septal cartilage, lateral process of septal cartilage. In the middle, you have the septal cartilage lah, in the middle, separating your right and left nasal cavities, and this is your ala cartilage at the side, and you have major and minor ala cartilage, which makes the side of your noses lah. Okay, and the nares is just the whole of the nose lah. Okay, so this is the more important bit, which is the nasal cavity itself. So inside the nasal cavity, what can we see? Okay, so it is divided into a few parts. Okay, so you have the olfactory region. This is the olfactory region because you have the olfactory bulb here, olfactory nerves coming out through this, the roof of your nasal cavity. Okay, and then you also have the vestibule here, and then we have the respiratory region, which is the main region where air is humidified and turbulent inside the nasal cavity. Okay, and you also have the auditory tube opening. This is the opening inside towards your ear cavity. So there is a pharyngotympanic tube which joins the pharynx or the nasopharynx to your tympanic, means the ears lah. Okay, pharyngo is pharynx, so it's pharyngotympanic tube. Okay, also called auditory tube opening lah. So there is a connection between your ears and your mouth. You know, if you go uphill, or if you're in a flight and you're going up, when the flight is going up, right, you can sometimes your ear is blocked, right? You cannot hear suddenly. So what you do is you close your mouth and you close your nose, right? And then you blow inside the closed mouth and nose. Suddenly there is a pop and you can hear again, right? Okay, so what happens is air inside your nasal cavity will go into your ear to help reopen your the pressure lah, to help similarize the pressure, or make it similar so that you can hear again. Okay, so that is why you have the auditory tube opening, which connects your nose and ear. So imagine if you have any infection as well. So say you have a sinus infection in your nasal cavity, that can also spread to your ear and vice versa lah. So if you have an ear infection, that can also spread into the nasal cavity through this auditory tube opening, or pharyngotympanic tube. Okay, so what else can we find in the nasal cavity? We have two nasal cavities, right? One left and one right. So it consists of the roof, the floor, lateral wall, and medial wall. The medial wall, of course, is the nasal septum that divides the two nasal cavities. Okay, the roof is formed by, this is the sphenoid bone here, the sphenoid bone, and then this is the cribriform plate of the ethmoid. Remember what we have in the cribriform plate of the ethmoid? This is where you find your this one, your olfactory nerves coming out. Okay, on the bulb actually sits on the cribriform plate here of the ethmoid, and the small nerves will come out through the cribriform plate inside the nasal cavity lah. Okay, and this is your frontal bone and nasal bone. So all these make up the roof of the nasal cavity. Okay, and what makes up the floor of the nasal cavity? It is formed by the hard palate, which is this palate here. Okay, the hard palate is formed by the palatine process of the maxilla, which is this part here, sorry. Okay, and the transverse process of the palatine bone, which is, this is the palatine bone, so the transverse process is just here lah. Okay, so this makes the hard palate. Okay, which is the floor of the nasal cavity. Okay, lateral wall. On the lateral side, you'll find the ethmoid, here. Okay, maxilla, the in red. Okay, and the lacrimal bone, the palatine bone, the sphenoid, and also the inferior concha. So all these make up the lateral wall of the nasal cavity. And medial wall, as I mentioned, is the nasal septum. Okay, so what are nasal concha and meatus? So we have 3 nasal concha and 3 nasal meatus. Okay, so this is the superior nasal concha, and inside it is the meatus. Okay, and this is the middle nasal concha with the meatus, and this is the inferior nasal concha with the meatus. So if we do a cross section, this is what we'll find. Okay, so the concha is the bone, and the meatus is the area behind it. Okay, or behind the bone lah. Okay, so this, if you do a midsection, and this is from anterior view, so you can see the sinuses, and this is the right and left nasal cavities. So you will find these bones called the concha, superior concha, middle concha, and inferior concha. Behind it, there is a passage called the meatus. So this is the superior meatus behind the superior concha, middle meatus behind the middle concha, and inferior meatus behind the inferior concha. So when we learn about sinuses, we will know why there are these meatuses lah, because the air from the sinuses will drain into these meatuses. Okay, for example, here you can see this is the maxillary sinus. So air from the maxillary sinus will drain inside the middle meatus lah, for example. So we will talk about the meatuses more when we talk about the sinus in a bit. Okay, so how about the nasal septum? What consists of the nasal septum? What can you find? Here is the septal cartilage. Okay, and then you have perpendicular plate of the ethmoid and also the vomer. So these 3 are the makes up the nasal septum lah. Okay, so just a bit of clinical correlate. Sometimes you can get CSF rhinorrhea. So did you read the news on a woman in the US. She had a nasal swab. You know, for COVID-19, you take the nasopharynx swab, right? But you have to go through the nasal cavity to get to the nasopharynx. Okay, apparently when they did the swab, they injured her nasal cavity, and she had CSF dribbling from her nose. If you know, that's a case, but we don't know what her background is. She might have had an operation done in the nose, so she's more prone to get it. But there is a passage, just to show you, there is a passage from the nasal cavity into your cranial cavity. So CSF can leak if there is a fracture of the cribriform plate of ethmoid. So if I show you here in this picture here, okay, so this is your brain already. You can see this is your pituitary gland, okay, and optic chiasm here, and this is your part of your brain already, okay. So and this is your cribriform plate, or cribriform plate of your ethmoid bone, right? Okay, so imagine if you insert something here and you accidentally fracture this part. CSF from the brain can dribble through the nose outside like that. Okay, so that's what that woman had lah. She had a swab, okay, which was supposed to be taken a sample from here. This is your nasopharynx, right, at the back of your nose. Okay, the sample should have been taken here, but accidentally it hit this cribriform plate. Okay, that's why CSF leaked out of her nose. Okay, does that make sense? Yes? No?
Yes, doctor.
Okay. Okay, so the leakage is called CSF rhinorrhea lah. Okay. So also, if there is a fracture at the cribriform plate, infection from the nasal cavity can also travel up into the cranial cavity, and you don't want that to happen, right? Okay. So you need to fix the fracture as soon as possible lah. Okay, so what about blood supply and innervations of the nasal cavity? So this is just showing you the blood supply of the nasal cavity. You have 5 branches here. Okay, here you have your anterior ethmoidal, posterior ethmoidal, sphenopalatine, greater palatine, and superior labial artery. Okay, so if you imagine, the name is just from where the bones are lah. Okay, so if you know, this is your ethmoid bone, right? So you have anterior in front and posterior at the back. So anterior and posterior ethmoidal arteries. Sphenopalatine, this is your sphenoid bone. This is your palate. So from your sphenoid to your palate, it's called sphenopalatine. Okay, the name is according to the bone where it originates. Okay, so you have your anterior posterior ethmoidal artery, sphenopalatine artery, greater palatine because it comes from your palate, so greater palatine artery, and superior labial. Labial is your lips, okay, and superior is your upper lip, so superior labial artery coming from your just behind your upper lip. Okay, so you have 5 branches, and these branches anastomose at the front or at the anterior part of your nose, forming the Kisselbach's plexus. Why is this Kisselbach's plexus important? Okay, because because of the anastomosis, there's a lot of blood vessel here, okay, at this area. So if a child, say for example, inserts something inside the nose, or if the air is too dry, sometimes it can cause bleeding of the nose, okay, because it is very anterior or quite close to the outside of the nose. So when you say for example pick your nose, or example, it is easily cause some trauma and can cause bleeding from your nose lah. Okay, sometimes when it's too hot or something like that, children especially can get nasal nosebleeds, right? Okay, so this is usually because of the Kisselbach plexus. When it's too dry, sometimes it can cause a bit of trauma to the small vessels vessels there and cause those bleeds lah. Okay. So I will talk a bit more about Kisselback's plexus in a bit. Okay. So innervation, it is divided into two. One is for special sensory, where there are your olfactory nerves lah for sense of smell. Okay, as we mentioned earlier, it is at the cribriform plate of the ethmoid. Okay, and as for general sensation, so if there is any injury in the nose, which nerves carry the sensation? So they are nasopalatine and nasociliary nerves. Okay, however, for the external skin of the nose is supplied by the trigeminal nerve lah. Okay, so just to show you here, so this olfactory nerve here coming out from your ethmoid. Okay, and we have your anterior ethmoidal nerve here and nasopalatine nerve here, greater palatine nerve and lesser palatine nerve. Okay, so here also you can see this is your olfactory bulb. So for special sensory, this is your olfactory nerve. Okay, and you have your anterior ethmoidal. Oops, sorry. Then we have nasopalatine, greater palatine, and so on lah. Okay, similar to this here. Okay, so just a bit more on Little's area or Kisselback's plexus. The area where you can find the Kisselback's plexus is called Little's area. Some people also call it Kisselback's area, Kisselback's triangle, or Kisselback plexus lah. Okay, these are the different names for the area where there is anastomosis of the 5 arteries lah. Okay, so the 5 arteries are anterior and posterior ethmoidal artery, sphenopalatine, greater palatine, and superior labial artery. Okay, so 90% of nosebleeds, or also called as epistaxis, occur in this area due to exposure or drying effect of inspiratory currents and also fingernail trauma. Okay, and also it is the usual site for epistaxis in children and young adults. I think I've explained this earlier, due to the location and also the anastomosis. So there's many small blood vessels there as well, so it is prone to nosebleeds, trauma, and can cause nosebleeds. Okay, so next is the paranasal sinuses. So what are sinuses actually?
Empty spaces.
Okay, empty spaces. So they're supposed to contain air. So you have sinuses or empty spaces here near to your nasal cavity, where it contains air. So it helps to help the skeleton of your head feel more lighter. If you imagine your skull is very big as compared to other bones in the body, for your upper limb, right? Okay, so it is very heavy also. So with the sinuses in your skull, it helps to create some sort of it's not really buoyancy, but it helps your head to feel a bit lighter because you have air inside it lah. Okay, so there's not supposed to be any fluid inside your sinuses. Okay, however, sometimes due to inflammation or infection, you can get fluid inside your sinuses, and that causes pain lah. Okay, so here you have your frontal sinuses in your frontal bone. Okay, then you have your ethmoid sinus. Ethmoid sinus is divided into 3 parts. We will talk about it in a bit. So it's more small sinuses as compared to the other sinuses lah. Okay, and then the third sinus is within your sphenoid bone, and that's your sphenoid sinus. And the fourth is your maxillary sinus within your maxillary bone. Okay, so this is another cross section. This is your frontal sinus, so just inside your frontal bone, and all these are your ethmoidal cells or ethmoidal sinus lah, make up the ethmoidal sinus. So it's divided into anterior, middle, and posterior ethmoidal sinus. And then here you have your sphenoid sinus inside your sphenoid bone. And you cannot see the maxillary sinus because it is on the other side of the cheek. If you imagine here, okay, so it is just underneath your cheekbone. That's why you cannot see it in the middle cross section. Okay, so these paranasal sinuses, if you imagine air comes in from your nasal cavity, okay, it goes inside the sinuses and flows back out through the nasal cavity and out lah. Okay, the nasal sinuses also helps in the resonance of your voice. If you imagine you don't have these empty spaces and the air just enters the nasal cavity and comes out, there's no what do you call it, empty spaces that create the resonance to your voice. Okay, so because there are these empty spaces where air can flow in and out, it also creates some resonance towards your voice lah. Okay, so where are the openings of the sinuses? So you have, remember your concha, so this is superior nasal concha, middle nasal concha, and this is your inferior nasal concha. Behind the concha, this is the conchas have been cut in this picture, so you can see the meatus inside. So this is all the meatuses. Okay, so at the meatuses are where the paranasal sinuses open. Okay, so here in the superior meatus, superior meatus, you have the opening for the posterior ethmoidal cells or posterior ethmoidal sinuses lah. Okay, and then here in the middle meatus, you have the opening for middle ethmoidal cells and anterior ethmoidal cells, and here also is the opening for maxillary sinus and frontal sinus. Okay, so most sinuses open into the middle meatus. Okay, and for inferior meatus, there's no opening for sinuses, but the nasolacrimal duct coming from, you know what the nasolacrimal duct is? It's your tear duct. So the nasolacrimal duct coming from your eyes here, okay, it will drain at the inferior nasal meatus here. Okay, this is where it opens. That's why when you cry, you also have runny nose, right? You have rhinorrhea when you cry, because actually when you cry, the tear ducts open inside your nasal cavity. Okay, so this is where it drains the remaining your remaining tears lah. Okay, it will drain inside the nasal cavity. Okay, so just to go one by one, the frontal sinus, it drains into the middle meatus, as I mentioned. Okay, and the ethmoidal sinus is divided into anterior, middle, and posterior. So the anterior and middle ethmoidal cells open into the middle meatus. I think you don't need to know the details like through the infundibulum and so on. As long as you know which meatus it drains into is sufficient lah at your level. So just remember, anterior and middle ethmoidal cells open into middle meatus, and the posterior ethmoidal cells is the only sinus that drains into the superior meatus. Okay, next, maxillary sinus again opens into the middle meatus, and the sphenoidal sinus also drains. Sphenoid sinus is a bit different. So if you see in this picture here, okay, so this is your sphenoidal sinus. It has an opening above the meatus, above the concha itself. So this is called the sphenoethmoidal recess. Sphenoethmoid because it's between the sphenoid and ethmoid bone. So sphenoethmoidal recess here. This is the opening for your sphenoidal sinus. So again, just to repeat, so in the superior meatus, what drains in the superior meatus? Which opening?
Posterior.
Anyone? Okay, posterior ethmoidal sinus. Okay, how about middle meatus?
Maxillary.
Okay, you have the maxillary, you have the anterior and middle ethmoidal sinus, and also frontal sinus. So all that drains here in the middle meatus. How about inferior meatus?
Lacrimal.
Okay, only your nasolacrimal duct. So no sinuses open in the inferior meatus, but only the nasolacrimal duct. Okay, as for the sphenoid sinus, the opening is here above the above all the concha and meatus. Okay, it drains into the sphenoethmoidal recess. So if you imagine you have an infection inside the sinus. Okay, it can spread here inside the nasal cavity, or from the nasal cavity infection can also spread inside the sinus. Okay, because they are interconnected through the different meatuses lah. Okay, what do we have now? Okay, so the infection is called sinusitis, infection of the sinus. Okay, usually it spreads from the nasal cavities lah. So it results in inflammation and swelling of the lining or mucosa of the sinus and causes local pain. So usually, for example, if you have infection in the maxillary sinus, for example here in the maxillary sinus, if you have infection here, when you press on the patient's cheeks, they will complain of pain because of infection and inflammation in the mucosa of the sinus lah. Okay, so that's the main symptom that you can find. And also, if the swelling is too much, it can block the opening of the sinus in the nasal cavity. So it can cause blockage of the drainage of the sinuses. So that can cause more problems and more infection in there lah, because the infection cannot come out. Okay. So last but not least, we talk about the nasopharynx. Okay, so this is the nasal cavity here. Remember, you have your ethmoid here, and you have your vestibule here, and these are your concas with meatuses. You have 1, 2, 3 concas. Behind them, you have the meatus, or the area behind the concha. Okay, and at the back here, the back of your nose, you have the first part of your pharynx, which is the nasopharynx. Okay, so remember I told you they take the sample for COVID-19. The sample is taken through the nose and into the nasopharynx. This is where the sample is taken. The swab sample is taken. That's why if you hear from people who have had the swab taken, they will say it's very unpleasant because the sample is not just through the nose, inside the nose, but it's actually at the very back of the nose. Some might say it's very uncomfortable. Okay, so this is the nasopharynx lah. Okay, apart from the nasopharynx, this is the mouth or oral cavity, and this is your tongue. If you see here, this is your tongue. So at the back of it, you have your oropharynx, and here, just after the oropharynx, you have your laryngopharynx lah. Okay, so we will only talk about the nasopharynx, which is a small area, so there's not much to talk about actually, but just a bit lah. Okay, so the nasopharynx is the posterior extension of the nasal cavity. The nasal cavity is open through the choana. Okay, choana is just the hole or opening from the nasal cavity inside the nasopharynx lah. Okay, and then so if you see here, so this is the choana lah. So just opening from the nasal cavity in front, okay, and opens into the nasopharynx. Okay, so What else is there? Okay, so also you can find pharyngeal tonsils inside the nasopharynx. I think that's the only structure you can find there, the pharyngeal tonsils. So if you see here in this picture, we have three types of tonsils. Okay, so pharyngeal tonsils is at the back of your nasal cavity actually. Only if it is enlarged, you can see it when you do an examination like this. Only if it's enlarged, it will come down and you can view from this angle. Okay, but normally when you have tonsillitis, the tonsil that is involved is the palatine tonsil, not the pharyngeal tonsil like usually. The one that the doctors like to look in your mouth and say, oh, you have tonsillitis, that's the palatine, not the pharyngeal. Okay, that's the most common lah. Okay, and you also have some tonsils at your on your um, lingual. Sekejap. You have lingual tonsils as well, palatine and pharyngeal tonsils. Okay, the one that is okay. Okay, sorry. My baby woke up already. Okay, so we have sorry, where was I? Three types of tonsils. Okay, and the one in the pharynx is the pharyngeal tonsils. So if we see here, this is your nasal cavity, and just at the back of your nasal cavity in your pharynx is where you find nasopharynx is where you find the pharyngeal tonsils. Okay. Pardon? Okay, uh, if you have infection or inflammation of the pharyngeal tonsils, it is called adenoids. Okay, and if it is very big, it can obstruct the passage of air from the nasal cavities through the choana into the nasopharynx, and that can cause the patient has to breathe through the mouth, as there's no air can pass through the nasal cavities into the nasopharynx. Okay. So if you can also block the pharyngotympanic tube, as you can see here, this hole here is your pharyngotympanic tube. That's another structure in the nasopharynx. So if the pharyngeal tonsils is too big, if there's inflammation and it becomes big, it can also block the pharyngotympanic tube. Okay, going to the ears. Okay, and that can cause hearing impairment lah if it is blocked, if the pharyngotympanic tube is blocked. Okay, and I mentioned earlier, infection through the nasal cavity and to the nasopharynx also can cause ear infection due to the connection lah, because they have the pharyngotympanic tube. So infection can travel through to and fro from the nasal cavity and into the ears lah. Okay, so if you see here, this is an example of an enlarged tonsil or adenoid, okay, coming from above. Here again, I think just all pictures of enlarged tonsils or adenoids lah. Okay, this is like very big. If it's not very big, if you imagine, if it's just until here, if you open the mouth, still you cannot see the tonsils. Okay, if it is enlarged, very enlarged, and it comes down up to here, only you can see the pharyngeal tonsils when you do an examination from the mouth lah. Okay, so I think that's all for nasal cavity, nasopharynx, and paranasal sinuses. Thank you very much. Oh, can you take the attendance also now?
Alright, doctor.
Sama cakap.
I sent the link in the chat.
Okay. So remember your practicals on Thursday and Friday will be from 9 to 12 for everyone. I'll just remind you in the WhatsApp group also. Okay, thank you very much. I'll see you on Wednesday for my embryology lecture. Okay, Assalamualaikum.
Guys, attendance, use the second link, not the first one.